I pledge the allegiance to the flag of the United States of America, to the
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Here.
Lewis,
Here.
Nelson,
Here.
Thomas,
Let's be muted.
here,
Okay.
Ursu.
Here.
Thank you. Okay, I entertain a motion to accept the consent agenda.
No
So
move.
moved. Second the motion.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Nelson,
Yes.
Thomas. Yes. Ursu.
Yes.
All right, we'll move to reports. Mayor, do you have a report?
Not this evening. I'd be happy to come in as we go along. We got a lot of legislation, and I think our my police chief is on vacation this evening, so he won't have a report. But again, I'd be delighted to answer any questions as we go along. Thanks.
Thank you. Fire Chief Newman, do you have a report today?
Yeah, I have. Thank you, Council President Henry, Mayor Roche, members of council, and members of our community. I do have a report with an update on the COVID-19 pandemic in our city. So based on the information provided by the Cuyahoga County Board of Health, as of December 4th, which was last Friday, there are 28,450 COVID-19 cases in Cuyahoga County with 716 lab confirmed deaths. 1,053 of the confirmed cases of COVID are actually in the 44143 zip code area, which includes Richmond Heights, Highland Heights, and Mayfield Village. Currently, Cuyahoga County is in alert status red, which is level 3, and that's defined as a very high risk of exposure and spread. We're still feeling the effects of the peak that occurred after Thanksgiving. We're about 10 days downrange, and so we'll start to feel it a little bit more in the next upcoming days and week. Governor DeWine announced details for Ohio's first phase of vaccine distribution that it's expected to begin on or around December 15th. The FDA is going through final approval of the Pfizer vaccine, and they expect approval, use approval, probably in 48 hours. In the state of Ohio, during phase 1, the vaccine supply will be limited, and Ohio will focus on vaccinating those who wish to be vaccinated in what they're calling the critical phase 1A group. And that's healthcare workers, residents and staff at nursing homes, residents and staff in assisted living facilities, patients and staff at state psychiatric hospitals, people with intellectual disabilities, residents and staff of Ohio veterans homes, and EMS responders. So sounds like a lot of groups. But on or around December 15th, a shipment from Pfizer will include 9,750 vaccine for Ohio's pre-positioned hospital sites, and an additional 88,725 vaccines will go to Walgreens and CVS for congregate care settings. So our distribution is relatively minimum, all things considered, our scheduled distribution. On or around December 22nd, a shipment of 201,000 vaccines is expected from Moderna, and that's pending FDA approval. And they're moving through that process as well right now. Those vaccines are scheduled to go to 98 hospitals for vaccination of those who are exposed to COVID patients, and to 108 health departments to vaccinate other frontline workers, such as those working in emergency and medical services. Then on December 22nd, another shipment is also expected from Pfizer. That's the second one from Pfizer that we'll be getting. This tentative number of vaccines is about 123,000 These vaccines will go to Walgreens and CVS for vaccination of those congregate care settings. And then a few days later, we're expecting another 148,000. So the vaccines are becoming a reality. They're in transit. You probably saw in the media today that the first citizen in the UK was vaccinated. It was a 91-year-old patient who was high risk. And the second one, who was an 81-year-old male, coincidentally, his name was William Shakespeare. So that's been in the media as well. These vaccines will be the first dose. This is a 2-vaccine regime. So you receive the first dose, and then 3 weeks later, there's the second dose. The efficacy of the second dose after that, they're saying, is in about the 95th percentile, which is really, really good. And, we're just keeping our eyes on this. Keep in mind that there are also Moderna and AstraZeneca. Their vaccines are all pending. Based on what I've seen on the various web portals and in the media as well, we're probably looking at mass vaccination of the public more in the second quarter of 2021. Probably May, June, July is what they're projecting at this point in time. But I'll definitely keep you posted as we move along. And, in the meantime, what can we do to stay healthy? Well, we can stick to the basics. We can wash our hands, wear our masks, even when you're with friends and family, stay socially distanced, work from home when you can, and stay at home when you're sick. Taking these preventative steps can reduce the spread and help keep hospital beds open, and that's really important right now. We can't pick and choose when we follow the safety guidance. We just must follow it every single day if we want to beat this virus. It is a virus, and our goal is to win.
Chief, I have a question. I'm sorry, Chief, I have a question. I don't mean to interrupt you, but we're right at that point where you're talking about. Is there a preference of which pharmaceutical company is better than the other, or is it a exact vaccine? Is one better than the other?
Well,
Do they have a higher percentage of?
Is based on their effectiveness or efficacy, and all of them have subtle nuances. They're all over 90%. I don't know if I would qualify that as, is one better than the other. Some are will probably be more conducive for public distribution. The common denominator of 2 of the 3 vaccines is that they require deep refrigeration temperatures, in fact, 70 degrees below. The third one doesn't have that requirement, where it requires that amount of refrigeration. And why that's a factor is not only do you need the vaccines and the vaccinations, but you need the infrastructure to keep it at a temperature where it can be preserved for distribution. So, one of the 3, which happens to be the AstraZeneca, doesn't require the deep refrigeration. But the efficacy, these are all very good vaccines. And in all of the studies, which is placebo versus actual vaccine, they've all had very high efficacy. So once they're out in mass distribution, they're going to be very effective. But it's going to take a little bit of time to get them all out of there.
All right. Thank you.
Madam President? Madam President,
Yes,
I have a question for Chief.
yes, thank you.
Chief, the second dose, I think you referred to 3 weeks later, you get the second dose. How precise is that date that you've got to get that second dose? In other words, if somebody forgets or they can't get that second dose, are they still instructed to get that dose as quickly as they can, or do we know the answer to that question yet?
I actually can't answer that knowledgeably. I just know that that's what the recommendations have been from the manufacturers, and that's what's being reported in public information through CDC and FDA. So to answer the question, I'm really not 100% knowledgeable on how to answer that.
Okay.
So wouldn't want to mistake.
Thanks, Chief.
I do have an update on our squad for council. As y'all, I've mentioned earlier, our squad 742 was actually damaged on UH hospital property back on October 24th, and it's currently being repaired. We are expecting it back this week, perhaps Thursday or Friday. University Hospitals has taken responsibility for all this and ownership of all this, and they're actually covering the cost of our repairs of restoring our squad. On top of that, you may see an ambulance with the UH shield on the side of it moving around Richmond Heights. That's because UH has donated the use of one of their ambulances so we can have a second squad. Roughly 20% of the time, we're running simultaneous calls. When one ambulance is out, we get a 911 call, and the second ambulance is out. So UH is providing us with the use of one of their squads, and also with the staffing to drive it. The staffing happens to be our personnel, but they're employees of the hospitals as well as employee of Richmond Heights. So UH has really taken care of us while our squad has been down, and we do expect it to come back and be placed back in service Thursday or Friday. Unfortunately, our other squad has developed an air leak in one of the tanks that makes the back of it go up and down so we can load the stretcher. So it's going to be out for a little while for repair too, not weeks, but probably days. So we'll get this one back, and we'll have to send the other one out for a relatively minor repair job. And that concludes my report. I'd be happy to take any questions. Thank you.
You got any guys with COVID?
No, we in the Division of Fire, currently we are fully staffed. Our guys are diligent about wearing their PPE. Of course, on every call for service, we treat every contact, whether it's on a call or not, as some potentially a virus spreader. In the station, we also wear masks 24/7 in the fire station. So when the firefighters get back from a call, they decontaminate themselves and they get rid of their disposable items appropriately. But we wear masks in the station around each other. The only time that we don't have a mask on is if we're in a work area or an office, for example, where there's nobody in the room. If somebody enters the office, we have to mask up, but it's become part of our lifestyle, and I believe that it contributes to why our workforce is staying healthy.
So you guys you have not had one in the fire department with all those people you encounter?
We have had one firefighter since the onset of the pandemic who was COVID-19 positive. We do not believe that it was a result of a patient contact while working at the fire department. We believe that it was a result of a family get-together.
Oh.
And so, but he went and got tested. His wife also had it, and he had mild symptoms, became asymptomatic, and at the time, 14 days later, he came back to work. So he missed a total of 5 24-hour shifts. He's been back now for about a month and doing well. And that's been the only documented case that we've had. It's been one individual who was out for a 2-week cycle.
Oh, that's good. That's good news. It's like now everybody knows somebody who's gotten it, if they didn't get it themselves. If they don't have it themselves. Yeah. So.
The estimates are 25% of the population is infected at this point in time, and they're feeling it in the hospitals. Earlier this week, I met with UH management team, and they said that a lot of their nursing staff, where they're becoming very multifaceted caregivers, where they may be normally assigned as a surgical nurse, but they're also working on the floors because they're feeling it in their staffing as well. They're sufficiently staffed, but their staff are doing a little bit more than they normally would in different areas of the hospital.
Well, I noticed I had lots of doctor's appointments this week, and nobody called to cancel any of my appointments. I was surprised because before they were saying don't come into these places, but I didn't have any serious problems. I was just like checkups, and they were like, come, and I have 4. Nobody said, it included the dentist. Nobody didn't say stay at home, which was interesting. All right, well, that's good news. Thank you. So we'll go on to Building Commissioner Jimmy Ranker.
Thank you, Madam President, Mayor Roach, members of council and the community. I have just one announcement to make. I've received an email from David Frank a few days ago while I was on vacation, and I guess they've secured ownership of the retention pond. So that will allow them to move forward with approvals the way the civil drawings were originally drawn without the use of any underground storage. I was on vacation and I just returned, so I don't have any kind of large report, but I'd be happy to take any of your questions.
Well, I'll spare you and give you a phone call later.
Okay.
Thank you. Anybody else have any questions for Jim? All right, we'll move to Finance Director Jim Technip. Thanks, Jim. Yeah, are you there, Jim Technip? You are.
Yep. Thank you, Council President Henry, Mayor Roach, members of council, and tonight's Zoom audience. The Finance Department continues to be busy. Recently, we're doing open enrollment for all our employees for medical insurance benefits. This is being conducted this week. Assistant Finance Director Tom DeLelio and I are reviewing and analyzing year-to-date financial records, which is necessary to prepare the 2021 temporary appropriations, final 2020 supplemental appropriations, reviewing grant funding, and the transfers for the end of the year, the final transfers. Additionally, Tom and I are reconciling the federal CARES Act funding expenditures, which includes an additional $45,000 to $46,000 in funds from Cuyahoga County for the supplemental reimbursements that were discussed in the Council of the Whole meeting this evening. Finally, Lisa D'Alessandro, our payroll associate, has completed updating payroll records, and this includes retroactive payments for the new firefighter collective bargaining agreement, and they have all been paid out over the last few weeks. And this concludes my report for this evening.
All right, thank you. Any questions for Jim? Okay, thank you. We'll move to Recreation Director Rick Dula. I didn't see him out here. He's not out here. Economic Development Director.
I'm sorry, I didn't get the mic quick enough. Yeah, Rick is asked to be excused this evening. He had some personal business with the family.
Okay, thank you. Economic Development Director Brian Glaser.
Good evening, Council President Henry, Mayor Roach, members of council, members of the community. We will be submitting the $150,000 block grant application this week. It's due December 11th. And we plan on bringing to Finance Committee next week the proposal for submitting the $50,000 Community Development Supplemental Grant. That's due early January. And then lastly, we had our first pre-construction meeting today for the Kiwanis Lodge improvements. We had the architect, the contractors, county community development representative, mayor, and myself, Rachel, Don Krasinski, Lee, Courtney, and Jimmy Rankar. This was to go over reporting issues that are required, and also the architect, Terry Saylor, was also in attendance. And we did a quick walkthrough looking at issues that might come up. And in a first draft schedule that they presented to us, they project completion by early May. Lots of caveats based on the COVID impact of when you can get the materials and impacts on subcontractors and the like. But they've tried to be conservative, and they're projecting an early May completion of this. And that completes my report. I'm available for any questions.
I have a question. Are they saying they're having difficulty finding people to do work too?
No, at the moment, no. But everybody's very aware that, people, as we heard from the chief, COVID is out there. So
I forgot about that.
at the moment, they tell us that they're ready to go, but everybody's throwing out the caveats now and everything.
Oh, provided everybody's well, like that.
Right, and continue to.
Yeah, and the supply chain is a challenge in most things. So if they specified, some of the things in the supply chain have slowed down. So we're working with them on that. So I think everything's working forward.
All right. Thank you.
Thank you. Any questions for Director, Economic Development Director? All right. So then we'll move to the City Engineer, Lee Courtney. I think that's, yep.
Just one item, Madam President. Today they started the restoration of the westbound lanes at the Highland Road water main break. Hopefully by the end of the week, they'll have the concrete in, and early next week, the asphalt topping, because all the plants have not closed yet.
I have a question, Madam President.
Yes, please.
Lee, I'm going to ask you again, what's leaking at the corner of Trubisky? Because I was sitting there the other morning when it was cold. Guy came out of Dunbarton and did a 360 right in front of me. I mean, we get down another month here when it's wet. Don's not going to be able to be there every day to put salt on it. Something's not right.
The water department knows about it because they've been there twice in the last week with a truck and a supervisor's car. They just haven't done anything yet. But I don't know whether that's because they're busy other places or they can't figure out what's wrong.
Well,
but it sure looks like a leaking valve to me.
I just don't want to see him pick up all that equipment and haul it off Friday without taking care of this thing. Because that's really dangerous there.
Right. So who follows up on that? Are you our guy to follow up and ask them? Because sometimes they park those trucks and they just have lunch and chat. So who follows up and asks them, do you know what the problem is? Do you know when you're going to fix the problem? Is that you?
Service director is the one that has the direct contact with them.
Oh, really? So Mayor, will you follow up on that? Because I noticed that water there also when it got really cold. So Mayor,
yeah, this is on a continuous follow-up kind of situation. We have another water valve leak that they've tried to fix 3 times over on Richmond Road. That's just north of the mall.
By the artist's house.
Yeah, and so these are challenges. They're working on probably 200 breaks in the county at any given time. And if it's a little bit of a leak, it's not as serious on their list as a big gushing leak. So, but that doesn't mean that we don't follow up and we don't try to get the resolution, and that we don't tell the water department that it's a serious condition.
Yeah. All right, thanks. I was just wondering who the man was to get to the end of the bottom.
I talk every once in a while. I talk to Alex, the head guy, and try to get an update. But the water department has had their challenges also, and of course we had that 54-inch main blow out the whole road, and they had to work on 3 weeks on it or more. Anyway, we don't let them forget us.
Okay, I trust that.
Madam President?
Yes.
On a positive note, I think our crews have been, I'm closest to it, of course, just being a few houses away from it, but hasn't been too slippery there. In other words, when it's freezing temperatures, we seem to have good coverage with salt. And right now, during the day today, for instance, it wasn't freezing, so there's some water there, but it's not unsafe as long as we keep it salted, and the guys seem to be doing a good job with that when it freezes.
Great. Thanks. Interesting. Thank you.
Absolutely.
So I guess we move on to Service Director Don Krasinski.
Thank you, Madam President. I'd like to do a little follow-up on what you were just discussing as well. The reason they weren't up at our location, especially for this valve, is down at the bottom of the 260th Hill and Euclid Avenue by the gas station. There were 3 water main breaks right in a row. They had 3 major holes opened up down there. In the morning when I would come in at 5:30, they would be working there all night long trying to take care of those water main breaks first. And so Mr. West says that they're quite aware of it. They understand the situation of the freezing, but when they have a major water main break where, you know, it's really shutting off a lot of water versus our valve just leaking a little bit, they have to prioritize. And so they are well aware of it. I keep in touch with them constantly about what's going on. So it's just a matter of priority for them right now.
Do you all know if the county has a plan to replace their lines? I noticed in Indianapolis, man, they had a plan and they just were constantly just replacing those lines, and it went on for years. Do they have a plan? Does anybody know if we have a plan in Cuyahoga County?
Yes, we do have a plan. They spend hundreds of millions of dollars. Cuyahoga County has, it'd be unbelievable how many miles of pipe that they maintain. The main pipe just before we put the Highland Road resurfacing in had a inspection robot go down the pipe to make inspections. And the challenge is that they can look at the inside of the pipe and see that, hey, there's no problems. But in this last break, I think they started to realize that the outside of the pipe is starting to deteriorate from the metal bands oxidating and causing problems. And of course, the outside of the pipe is hard to inspect because it's all buried. The inside of the pipe, you can put a rope, you can put a robot down the pipe and look at it, but the outside is a give and take on what that is. They do maintain a great database on number of breaks and how much it costs on any pipeline, and they evaluate that on replacement. So when the number of breaks goes beyond a certain limit, that pipeline is on the list to be replaced. Our challenge, and they try to coordinate that with road work and such, and they actually try to do that. There's any other questions along those lines, but one of the things that I've been on the committee is one of the cost basis that they don't add to the equation is the cost typically that the city has to do to beyond what they reimburse us for. In generally on minor breaks, they basically reimburse us for the hole that is created by going in and repairing the pipe. They do not reimburse us for the lateral damage of the high pressure, delaminating the roadside or undercutting the road surface, and those are the costs that become expensive. Our last break at the fire station there across from the post office and the fire station, we've gone out, and I believe we're going to get some insurance coverage for that. So between the water department and the insurance, hopefully the majority of that cost gets covered.
Yeah. Well, so what I was wondering if they had a strategic plan for replacements throughout
Yes,
the
they do.
county versus a maintenance plan, like looking at the probability of one breaking versus saying we're just going to hit a section and we're just going to start replacing that.
No, they have a strategic plan. They have a break. They follow break counts. They actually have now a software package that evaluates every shutoff valve in the system. They evaluate every number of feet or whatever, and they have a scenario of how to replace that. The challenge is there's a lot more. There's a lot more pipes to be replaced than money to do it, and that again they do it as a priority basis based on statistical information.
Thank you, Mayor. All right, I was wondering because we got problems here. All right, it's time for audience comments. Any comments?
I have one question for Don, Eloise.
Okay. I'm sorry, thanks. Okay, Don or Mark?
Ms. Mark, what's your outlook for leaves and branches? I mean, how far do you think you're going to go?
Well, on the leaves, when the snow melts down, we'll be out there picking up the leaves. We want to make sure we get them all picked up. And we'll be doing it until they're actually gone. Right now, the snow was still on the ground, so we went out for the last 2 days, and probably the rest of the week we'll be doing branches and taking care of those throughout the city. We got a lot of pine trees that had severe damage from the heavy snow on that December 1st storm. So there's quite a few houses with a lot of those sticking out onto the street there. So we're working on the branches right now. And we'll be back on leaves as soon as the snow gives us enough opportunity to pick them up. We can't suck them up with the snow in it because it freezes in the pipe as it's going into the back of the other truck.
I understand, but as far as people ask, you'll definitely make one more round once the snow falls.
We'll make more than one round.
We'll be making.
I will take care of this. You know, we will be going around until necessary to make sure that it's all picked up because we don't want to see that in the springtime.
Okay, thank you very much.
I also want to make a comment that give a kudos to the guys that were working on doing the branches today. I got a phone call from a resident on Heather, which we rarely get anything that they say something good, but they commented that my guys did such a great job in front of his house that he went out and looked. He couldn't even find another twig on the street wherever they cleaned it up so well. And then they went across the street and trimmed up a couple other trees and chopped up all the branches from that as well. So he just called and wanted to say thank you very much for doing a good job. And I passed that on to my men. And I just want you to know that they're out there doing their best all the time.
Okay, 'cause the thing that I noticed was that CEI came around, the illuminating company came around, and they trimmed some stuff away from the ones that were leaning on electric lines, and they kind of just, normally they take it with them, but I guess they had so much that they just came and trimmed and left the stuff lay. So I guess you're probably picking up some of that.
Yeah, we'll be picking up anything that's on the tree lawn. That's all I have.
All right, thanks, Mayor. I mean, and I'd like to thank your crew also. We had so many leaves out in front of my yard, and I could not believe, I mean, on the tree line, your guys cleaned up every leaf. I didn't expect that. I thought they leave something laying. It was amazing, but not only did they do my yard, they went all the way up and down the street. It's amazing how good a job they do. So, I mean, it's impressive. I've never had that many leaves out. My son finally did a whole bunch of work one day, and I just did not expect that they would have cleaned it up that well. I mean, that your guys would have finished up the job so well.
Let me give another kudos out to my men because on that December 1st storm, we had every truck out, every guy was driving, doing their job that they needed to do. And I don't know how many of you ever got out around the city in the evening, but we had our streets cleaned before any of the other cities had theirs done. Ours were completely passable, and every other city around us was still working on it. So with the guys that we had and the equipment, we even had some breakdowns, but we kept things going. They did an excellent job. I couldn't have been more proud of what they did for the city and the residents.
Yeah.
That was a hard push on the snow.
Yeah, I've seen them do that after the snow too, so you're right. It's impressive. Oh, I tell you. So thank you. Thank you, guys. Tell them I said thanks as well. Right. So any more comments for Don or questions or concerns? Okay, we'll go to the audience. Audience, do you have any comments, questions, concerns? Okay, we'll move to old business.
Under old business, we have ordinance 107, 2020, introduced by Henry, second reading. An ordinance adopting new chapter 172, technology policy in part 1, administrative code of the codified ordinances.
All right, we're gonna hold this on second reading.
Ordinance 108, 2020, introduced by Henry, second reading. An ordinance adopting new chapter 171, technology advisory committee in part 1, administrative code of the codified ordinances.
We're going to hold that also on second reading.
Under new business, we have resolution 119, 2020, introduced by Mayor Roach, first reading. A resolution accepting a donation from Richmond Heights resident Samuel Johnson of multiple drones to the Division of Police of the City of Richmond Heights and expressing appreciation to Mr. Johnson.
Okay, we're gonna hold down the first reading. We do appreciate it, but we're gonna hold it on first reading as well.
Resolution 120, 2020, introduced by Mayor Roach, first reading. A resolution authorizing the mayor to enter into a memorandum of understanding with Cuyahoga Soil and Water Conservation District and the Northeast Ohio Regional Sewer District for the provision of technical assistance in implementing soil and water conservation measures.
Mayor?
Yeah, as we had discussed earlier in the committee of the whole, this is pretty much a routine resolution. I recommend its passage this evening.
Move for suspension.
Second.
Alexander?
Yes.
Henry?
Yes.
Lentine?
Yes.
Lewis?
Yes.
Nelson?
Oh yeah, Nelson has an emergency. We need to excuse her, so she sent me a text.
Okay. Thomas?
Yes.
Pursue.
Yes.
Move for passage.
Second the motion.
Alexander?
Yes.
Henry?
Yes.
Lentine?
Yes.
Lewis?
Yes.
Thomas?
Yes.
Pursue.
Yes.
Okay. Resolution 120, 2020 passes unanimously.
Resolution 121, 2020, introduced by Mayor Roach, first reading. A resolution authorizing the mayor to execute on behalf of the city the renewal of a partnership agreement to a memorandum of the city of memorandum of understanding as a member of the Euclid Creek Watershed Council with Cuyahoga Soil and Water Conservation District.
Mayor, you want to say something on this?
Again, yeah, we had discussed this in the meeting of the whole. This is another routine partnership agreement that we've had over the years. Again, this is for the years 2021 to 2024, $3,000 a year annually. And again, this is reimbursed from, I believe, our fund from the stormwater fees. I'd recommend pass this evening.
Motion to suspend the rules.
Second.
Alexander?
Yes.
Henry?
Yes.
Lentine?
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Move for passage.
Second the motion.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Resolution 121, 2020 passes unanimously.
Resolution 122, 2020, introduced by Alexander, first reading. A resolution approving a modification to the site development plan for a mixed-use development on permanent parcel number 662-27-048 at 621 Richmond Road.
Comment, Mr. Alexander?
This is a modification on phase one, the site plan. Originally, the leasing office was to be a temporary building. They now are requesting it to be a permanent. This was unanimous out of the Planning and Zoning Committee and also out of the Planning and Zoning of Council.
Motion to suspend the rules.
Second.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Move for passage.
Second.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Resolution 122, 2020 passes unanimously.
Resolution 123, 2020, introduced by Alexander, first reading. A resolution confirming the action of the Planning Commission with respect to the approval of a conditional use permit and a site plan for a drive-through retail facility at 818 Richmond Road.
This gentleman wants to put in a cigar store at the Old Michelle Dry Cleaning, and because it's a drive-through, he needs a conditional use. This was unanimous through the Planning and Zoning Committee and also through the Planning and Zoning of Council. I would move for suspension.
So moved.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Move for passage.
Second.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
Resolution 123, 2020 passes unanimously. Somebody's got a television going, else they have a hell of a conversation going on in the background. So whoever you are, can you mute it, please? Because my attention span is a little slow here. So we have one more piece of legislation that I need to make a motion. So I move to authorize the mayor to do something, to accept the money from the county in the amount of about 40.
Yeah, I can give you the exact number. I got it here. It's $45,655.64.
Okay, I move the mayor accept the money from Cuyahoga County CARES money in the amount of $45,655.64.
And I think, I don't know, the other added addition to this is where you probably need to appropriate this money. We actually have to spend some of the money. Some of it's already spent, but and get this is more of a reimbursement kind of situation.
Right, I know.
The timing. So I think we want to also, Todd may have the fine words on this, but appropriate that money.
All right, Todd, here's us.
I would say that the motion should continue on to say that council appropriates those funds for the purposes set forth in the list that was distributed to council. those expenses in that list that was distributed to council.
Okay,
Which 100% is a background discussion, 100% covers the monies that we got.
okay, let me try this motion again. I moved that the mayor, I move that we accept the money from Cuyahoga County in the amount of $45,655.64 for the
And council appropriates.
council appropriates those funds for the expense distributed to council.
I'll second that.
Thanks.
Alexander,
Yes.
Henry,
Yes.
Lentine,
Yes.
Lewis,
Yes.
Thomas,
Yes.
Ursu.
Yes.
All right, motion passes. Anything else to go before council?
Oh, Madam President, is Don, Service Director, still online with us?
I don't see him.
Or maybe somebody else knows the answer to this question. One of the things I've noticed is that after the snowstorm, the arborvitae trees, which, we have some at DeSand, for instance, but just generally in the area, they really took a beating from that storm. And I don't ever remember that type of tree suffering so greatly from the first snow. Other people have noticed as well as me. Does anybody have heard any reasons for that? Why they're
Well, typically it was a wet snow, and the wet snow sticks to things, and
yeah, this
and
must have been
luckily most of the leaves on the trees that are indigenous to the leaves have fallen, but we would have had a lot more broken limbs. But
yeah, it must be an extraordinarily unique, heavy snow.
well, we had 18 inches of wet snow.
Yeah.
And
Yeah.
so
That was a sign of it.
and there was high winds, and we had over 50-mile-an-hour winds. So the wet driving snow took its toll.
Yeah, I'd say it was extraordinary. Thank you, Madam President.
You're welcome. Thank you. Anything else to go before council? All right then, meeting adjourned. Thank you all. Have a good night.
Have a good night, everybody.
Good night.
Thanks.
Thank you all.
Go Browns.
Yeah, go Browns.